Dear colleague, welcome. It's Dr. Jack. I'm at Wild Dunes Resort outside of Charleston, South Carolina. And today I continue in my month-long focus on work-related burnout and flourishing. And I wanted to raise two new additional topics, and that is curiosity and commitment. So let me back up and start at the beginning. So burnout is one of those situations where it forms positive feedback loops. And positive does not mean desired in this case or beneficial. It just means that when the value of one variable goes up, it leads to changes that then further increase the value of that variable and increase the values of other related variables. So for example, wealth begets wealth. Aggression can beget more aggression, and burnout begets more burnout. So for example, if a clinician is feeling stressed out, emotionally exhausted, they are more likely to make a medical mistake. And it may be inconsequential. It will not hurt the patient in any way. But how do you think that clinician will then respond? Well, with second guessing themselves, with kind of emotional upset, maybe they can't sleep well that night, and guess what? It just increases burnout. They're that much more likely to feel emotionally and physically exhausted and to even make more medical mistakes. So burnout begets burnout. So today I want to cover the positive aspects of how we can short circuit one of these vicious feedback loops. And the two words I'm going to cover today are commitment and curiosity. So I think one thing that burnout leads to is a distancing from one's commitment to one's profession. It's very easy to get into that mindset of like I have one foot in, one foot out. And it's almost like the worst of both worlds. Therefore, the clinician remains in a profession, in a position where they do not feel happy, they are stressed out, their burnout is maybe increasing, and yet they're really not taking any effective steps to leave their profession. So they're kind of stuck in this kind of in-between state that is just leads to a lot of unhappiness, stress, and probably not ideal patient care. So sometimes the best thing to do is just to consciously, intentionally recommit to one's profession and say, you know, no matter what happens, I'm a physician, I'm a clinician, and this is what I'm going to do for the rest of my working life. And once you have that kind of a mindset, it really forces other kind of considerations to take place. Like, well, if this is what I'm stuck with, quote unquote, stuck with, what do I need to do to make it work for me, for my patients, for my family, for everyone involved? And I think then that can really lead to those beneficial changes. So for example, the two on rank lists of like what stresses out clinicians the most, one is dealing with the electronic medical or health record. So, you know, if that's a source of stress for a clinician, it could be like, well, look, I really hate, you know, this EHR, EMR. Maybe I just need to like learn it better. Maybe I just have to hunker down and really just get a handle on it, because if I'm committed to my profession, it's not like EMRs are going away. Hopefully with time they will become user-friendly, but in the meantime, maybe I just have to, you know, kind of get a handle on it, try to master the darn thing. Another source of stress is all the paperwork that we have to do. So this is like, instead of the EHR, now this is focusing on the actual content. And clinicians spend way too much time on charting. And many clinicians are both inefficient, meaning it takes too long of a time, and they're maybe not that effective, meaning they're leaving out important information while putting in a lot of maybe less than important information. So again, if you commit and say, well, this is going to be my profession for the rest of my working life, then you say, well, how can I get better? I actually need to take steps to get better, because otherwise there's no getting around it. I'm going to be unhappy, stressed out today, tomorrow, next month, next year, next decade, right? So kind of recommitting oneself can have really a lot of salutary effects. And this is equally true for personal relationships. So, you know, many times, you know, person, especially when you're younger, you're dating someone, you're kind of 1 foot in, 1 foot out, right? It's that whole FOMO approach, which stands for, fear of missing out. And so there's always that kind of hesitation to really commit to a person in this case, when, of course, I'm talking about committing or recommitting to one's profession. The second word for today is curiosity. And I think curiosity, if we can reawaken that as we're seeing patients or dealing with administrators or whoever, I think that can really lead to some virtuous cycle to oppose these vicious cycles that we face with burnout. So if a person kind of says, no, I'm going to approach every situation with curiosity. So imagine how many patients you have who just do not follow your advice. You're telling them, if you don't take your medications as prescribed, it's going to shorten your life. It's going to make you miserable. It's going to lead to hospitalizations, what have you. So many of our patients don't follow our advice. And it's very easy to get irritated and then maybe even act out in some semi-unprofessional way towards a patient, and then feel all guilty and ashamed about that. And, again, that kind of leads to adds to that burnout. But what if we said, well, okay, so here's still another patient I've been telling, take your meds, take your meds. It's not working. It's not working. So what else can I do? What else? Let me think outside the box. What can I do to help this patient become more adherent? After all, it's their health, it's their life. No matter whether they take their medication or not, I'm still driving my nice car to my nice neighborhood to be with my nice family, right? And to take a nice vacation. So it's really not hurting me, so maybe I don't have to get so upset, but it is hurting them. How can I think about the situation differently to help them make maybe more informed decisions, more beneficial decisions for themselves? What is getting in their way? So again, if we think about how do we consciously and intentionally recommit to our profession and in a way recommit to feeling and thinking a curiosity, having that mindset of curiosity. Like, there's so many things that we can't control, certain things we can, but if things don't go the way we want them, ask, well, why? Why is that? What are the factors leading to that? And what could I do maybe in a different way to try to get some more control over the situation? So this is Dr. Jack signing off for today. Thanks so much. Take care.